You called an ambulance to the ER for a toothache?
It's unbearable. Help me, please. Oh, it hurts so bad.
Oh, Sandra, you're back again. How many times is this now?
This week? 7. Love the new haircut.
Thanks. Okay, open up, let's take a look.
No, I don't want it. You can't treat me.
I just need to take one look, Sandra.
I want to leave. Give me the AMA paperwork.
You're leaving against medical advice again?
There's something about the lights in here I don't trust. And the walls.
Enough, Sandra. Here is the paperwork to say you are denying medical advice and treatment.
Thanks, I feel so much better now.
Is the patient ready to be seen? No, she's using us. Calls 911, gets a free ride into downtown, signs out AMA, and goes straight to work the corner.
Not the corner. My corner.
Wait, so we're a glorified Uber to her?
Yeah, 5-star rating. Do you want to know my rate, Doc?
Nope.
I'll see you outside.
Interesting. Happy Thanksgiving! We have a woman with a sweet potato stuck in her vagina. I just got here, Rich, and I am so happy to see you. Come on, she's in room 7. I'll introduce you. Oh. Ma'am, this is our doctor. He's gonna take a look, inside of you.
Please hurry. I have to get home and finish making dinner. My family's counting on me.
This shouldn't take too long, ma'am. Oh my God. What is it? This thing is huge. The potato or her vagina?
The potato.
Oh.
What does that mean? You can't get it out?
No, ma'am. You're gonna have to go to surgery.
But I don't have time for surgery.
There's no way I could remove it here. The surgeons are gonna have to go in, cut it into smaller pieces to remove it.
They're gonna cut it up?
It's called a piecemeal removal.
That's great news.
It is?
Yes. Can you ask them to dice it up into inch-sized cubes for me?
Excuse me?
It'll take some of the dinner prep off my plate. That way, when I get home, I could just throw it in the oven.
Ma'am, you can't just take the sweet potato out of your vagina and bake it like normal.
You're right. It's been in my body, which is warm, so it's probably already a little cooked. I'll take that into consideration when I set the timer.
Ma'am, you're not actually thinking about serving your family the sweet potato that was inside of you.
Don't be ridiculous. I'll peel it first.
Ma'am, that cannot be sanitary. It was in you. It's okay, Rich. Ma'am, you're right. We're gonna do our best to get you out of here so you could be with your family on Thanksgiving.
Thank you, doctor. Oh, wait, before you take me to the OR.
What are you doing?
Well, I'm not gonna serve my family unseasoned sweet potatoes.
Oh, no. Ma'am, no. No. It hurts right here. Your CT scan shows a foreign body object in your bladder. Do you have any idea what that is?
Oh, that's totally my bad. I forgot about the vial of cocaine I shoved up my pee hole. It's probably that.
You shoved a vial of cocaine up your penis?
Yeah, man, my house was getting raided. What else was I supposed to do?
I don't know, not shove a vial of cocaine up your penis?
Bro, you would have done the same thing if you were me.
Have you been able to pee?
Yeah, I kind of just moved to the side and I peed.
And it's never fallen out?
No, which is a real bummer. I really want that cocaine back. I had to go buy a whole nother vial.
Sorry to bother, just doing my rounds. You guys good?
Another raid!
Are you shoving a second vial of cocaine up your penis?
No.
This is not a raid.
Oh, then yeah, that's exactly what I was doing.
No, now what are you doing?
Ordering another vial of cocaine. I gotta replace the one I lost.
Ugh, I hate working Halloween. Hey, I need help. Yeah, just have a seat. We'll be with you in a second. I have an axe in my head. Have a seat and we'll be with you in a second, sir. Every year, these kids with their fake injuries trying to prank us. I know, we don't have time for this today. Can you just get them out? Gladly. What seems to be the problem, sir? I have an axe in my head, and I think I'm losing a lot of blood. I see. And when did this happen? Just now. I was attacked by a crazy guy on the bus. I think he was trying to kill me. Oh, crazy guy. Haven't heard that one before. I don't get what's happening. Come on, did you really think this was gonna work? I'm just looking for some help. It was a very funny prank, sir, but we're really busy here tonight, so you can cut the act. Yeah, and next time you try this, invest in some better fake blood. See how good his looks? This is just embarrassing. I mean, what is this? Ketchup? Ow! Oh my God, what? I don't think this is a prank. Are you serious? Sir, did you really get attacked by a man with an axe on the bus? Yes, obviously! Doctor! Your vitals are stable, I just gotta check your IV.
No problem. Ew!
Oh my God, I'm so sorry.
Did you just rub the drool into my arm?
I don't know, I think I panicked.
That seems worse than just leaving it, don't you think?
No, you're right.
I'm sorry.
Ugh. Well, is the IV working at least?
I don't know. I could check. Do you want me to check?
You're asking me?
Yes?
Yes, check! And swallow before you lean over in case you have some more drool.
Okay, IV looks good. Hey, what's wrong with your face?
I think I have to sneeze.
Oh, I'll get you a tissue.
Achoo! Even?
Even.
Nurse!
Yes? Can I help you?
We need that blood transfusion? What the hell is taking so long?
The what?
The blood transfusion? Do you want my husband to die?
Ma'am, your husband is here for a persistent cough. He doesn't need a blood transfusion.
Wow, do I really have to explain it to you?
Oh, you actually don't. He's not my patient, and I was actually just on my way to...
He's a smoker.
Okay.
And cigarettes contain what?
Tobacco?
No, nicotine.
Kind of the same thing.
And nicotine is stored where?
In the cigarette?
In his blood! It's in his blood and it's killing him right before my very eyes. You need to give him a blood transfusion to filter out the nicotine that is in his blood.
Oh. Yeah, no, that's not how that works at all.
How dare you? I have been taking care of my husband my whole life. I know what I'm talking about.
Do you have any sort of medical degree to back up this information? Because we have actual doctors here with medical degrees. I know that sounds crazy these days.
That's it! You are rude and incompetent, and you are trying to kill my husband. I am going to sue you for medical malpractice. Now, what do you have to say about that?
Can we actually talk about this after my break?
Where do you have to go that is possibly more important than saving my husband's life?
Well, after talking to you, I could really use a cigarette.
Amen, brother.
Hello?
Oh, good, you must be Dad. Come on, shirt off. Let's do skin to skin.
I got pad thai with extra spring rolls.
Perfect. 15 minutes and you both can eat. Come on. Here you go.
Whoa, it's like a real baby. Crazy.
I know. Holding your own baby for the first time is totes crazy. But you'll get used to it. Honey, you shaved your mustache?
I'm here. Where's my son?
Your son? Then who are you?
Uber? I'm delivering food to room 503.
Oh. Yeah, that's down the hall.
Did you just have an Uber driver take their shirt off and hold my baby? Actually, they took my shirt off for me.
Okay, let's everybody calm down. Just hand the baby back and we can forget this even happened.
Okay. Just 5 more minutes?
Give me back the baby!
Honey, it is mine, right?
Honey, put that down.
I came as soon as I heard.
Louis! Thank you so much for visiting.
It's so nice of you to bring flowers.
And don't worry, I will take care of everything at the office so you can recuperate. Sir, what are you looking at?
I'm trying to find out where this light's coming from.
It's over your bed, dear. See, you pull the string to turn it off.
Last time I pulled your string, you bled for a week.
You pulled your wife's tampon string out?
Louis, that is inappropriate to say in front of your boss.
You're right, I'm sorry. I didn't mean to. I have to ask. Why did you feel the need to pull your wife's tampon string out?
Well, he didn't need to.
I thought it was a loose thread from her dress.
Hanging from between her legs?
Louis!
You cannot speak to my wife that way, Louis.
What? You started it?
What I do with my wife's menstrual blood is my business.
What do you do with her menstrual blood?
Louis!
You're fired.
What? You're the one that said it. You know what? Fine, whatever. Here, take your flowers and shove it up your...
That's exactly what I did after I pulled your string.
You shoved what up where? Welcome to the ER, sir. How can I
need help.
Oh, it's you, Carl. Hey, Betty, Carl's here again.
Is it 2 a.m. already?
You both know me?
Well, it's not hard to remember the guy who comes in regularly at the same time wearing the same thing.
Mormon garments, right?
You noticed my Jesus jammies.
They're pretty recognizable, Carl. And you always have a wooden dowel stuck in your rectum.
This time it's different. I have a cough.
And that wooden dowel sticking out of your pants?
Oh, this? While I'm here, if I could get that out too.
Of course. Let's get started.
Thank you, and please.
Please don't call my wife.
Yes, we know, and we won't.
Does everybody here know me?
Hey, Carl, what's up, man?
Oh,
Look, it's Carl. Good morning, just checking in. And who might you be, sir?
at least there's one person here who doesn't recognize me.
I'm just joking, I remember you, Carl.
I remember you too.
Hi, Merlin. Just wanted to warn you, your patients in room 2 are very high energy.
High energy or high energy?
They're high as fuck.
Ugh. Let's get this over with.
I can go faster, babe. You want me to go faster? Whee! Hello? Oh, what's up, man?
Hi.
Yeah, I'm here to examine someone with a burned hand.
Oh, that's me. I burned my hand on the stove.
Babe, you can't lie to the doctors. That's illegal.
Okay, it wasn't from cooking. It was from my crack pipe. We smoke crack. Ah!
Not a doctor, not illegal to lie to me, but good to know. Okay, is the burn infected? Are you in any pain, ma'am?
Oh, nothing that bad. It's been really hard to work lately.
Ask her what she does. Do it. Ask her. Fine. What do you do for work, ma'am?
I'm a pole dancer.
She's a pole dancer!
Yeah!
Great. Can I please see the burn?
I love this woman! Shake it. There, shake it.
Dance
Shake
with
it.
me, babe.
Shake
Dance.
it.
Guys, look, if I get you some ointment, will you please just leave? Ointment? Come on, man. What about the meds? I think we both know you're good on meds. Oh, he got us.
He caught us.
babe.
He caught us.
He caught us.
caught us.
He caught us, babe. He caught us. He caught us.
He caught us. No! He caught us.
He got us.
Since you're new here, we're gonna start you off with something easy. Miss Lewis is very sweet and isn't sundowning anymore, so we need you to get her out of bed.
Sounds simple. No problem. Miss Lewis, I'm here to get you up.
Miss Lewis? What happened?
Miss Lewis just kicked me. That Mrs. Lewis?
Yes, she's surprisingly strong.
Hi, baby doll. Why are you on the floor?
I'll have you know, we don't tolerate lying about our patients here.
But it's true.
We need Mrs. Lewis up and out of bed so she can have her walk down the hall. Is that okay, Mrs. Lewis?
Yes, my dear, I'll try.
Good.
Okay, Miss Lewis, it's time to get you up.
Hi, Carol. I see you're here for a lump on your breast.
Yes, I'm worried it might be cancer.
Let's take a look. When did you first notice the lump?
A few weeks ago while I was in the shower.
Huh. There's a bruise under there. Was there an accident?
Yeah, it's my husband. He can be a real ass sometimes.
You're saying your husband did this to you?
Oh, you know, I'm a little uncomfortable talking about it, since that's not what I'm here for. Can we just focus on the lump?
Of course. Can you give me a minute? I'll be right back.
Hey, have you seen our social worker?
Yeah, she's helping me discharge the homeless man in bed too. He's still here? He came in for sore knees.
And now he wants to be admitted because if he has to walk again, his knees will hurt again. He's not leaving. Call security.
What?
He's demanding we give him an electric wheelchair to help him get around.
We can give out electric wheelchairs in the ER?
No, dumbass.
Oh, hey, can you come check my patient? I think her husband's beating her.
Why do you think that?
I was checking her breast for lumps, and I saw a bruise under one of them.
That's a very uncommon place for a bruise to appear in domestic violence.
Yeah, that's more likely from a car accident.
That's what I thought, but then I asked her about it, and she said her husband did it to her, and that she didn't want to talk about it. Now that might be a sign of domestic violence. Let's go talk to her.
Don't forget about bed 2! Okay, Carol, I'm back, and I brought a colleague with me.
Hi, Carol. I'm the ER social worker. Social worker? Why do I need a social worker?
We just want to talk about what's under your breast.
Oh my god.
It's gonna be okay.
I have cancer?
What? No.
Then why did you bring a social worker in here?
We just want to talk about the bruise that's under your breast.
I said I didn't want to talk about that. I know this is difficult, but if someone at home is hurting you, we need to— No one is hurting me.
Carol, you said your husband gave you that bruise, didn't you?
Yes, but not because he's hitting me.
Then how did he bruise you?
It's a hickey. My husband likes to suck on that part of my breast when we have sex.
Oh.
Oh my god, this is so embarrassing. So there's no domestic violence? No. We're trying for a baby. And my husband, he gets really excited when he sees— You know, you really don't have to explain to us if you don't want to. We're good. Fine. Can I see you outside?
32-year-old female chief complaint of lumps on breast. A small hematoma was found under patient's left breast due to Hickey per husband. Cancer screening was negative. Vitals are stable, no further incident at this time. You want to work at this nursing home? Let me give you some advice. Stay awake at all times. Drink coffee, do jumping jacks, slap yourself in the face if you have to. Why aren't you writing any of this down?
Hey, everybody!
Hey, I think Mr. Simmons is having an emergency. No, he's not.
I got something to say.
Are you sure? Listen to him. I should go help. Trust me, you're gonna want to wait a second.
I'm coming in my pants!
Did he just say? Yes. Yes, he did. But how is he doing that? He's not. He's peeing. How do you know? Look, after a few months, you're gonna get to know the regulars. Screamers who want attention, old ladies just coming by to hang out, and guys who piss their pants and think they're coming. That's good to know. Thanks. I should go help him clean up, right? Help me get the hang of things? Nah, I'll take this one. You got your whole career to figure this stuff out. Oh, thanks, that's so nice. Oh no, is he reaching into his pants? What's on his hands? Oh my god. I guess he wasn't peeing.
Hey, you!
Me?
Yeah, you! They made a mess here. Help me get cleaned up.
Oh, I can't right now, but our new nurse will be more than happy to help you out. What? You just said, hey, do you want to be a nurse or not, damn it? You gotta learn sometime. Get in there. Fine. Mr. Simmons, I'm coming.
Me too.
Mr. Siegel, what are you doing here?
I'm here to see my wife.
We transferred your wife 3 days ago to a nursing home.
I think she's in this room over here.
Fine. You'll realize she's gone once you see the empty bed, just like you have the past 2 days.
Help! Help! My wife,
Not in her bed, I know. We transferred...
My wife is dead!
What?
She's not moving!
Mr. Siegel, there's nobody in that bed.
She's right there and she's not waking up!
That's impossible. We transferred her 3 days ago. Right? What the?
My beautiful wife!
Who the is this?
It's my wife!
No, Mr. Siegel, this is not your wife.
It's not?
No, this is another patient and... Oh my god, she's not breathing. Help! Oh, hey, that's my patient. She's not breathing. I know, she passed this morning. DNR palliative care. It's fine. Oh. Can we keep her here until they're ready to come get her? Yeah, no, of course. It's so funny. Mr. Siegel was just trying to wake her... Mr. Siegel, what are you doing?
I'm giving my wife a kiss.
No, that is a dead patient.
She's dead? No! My wife! No!
Ma'am, we've had multiple staff members report that you've been vaping in here.
Vaping? Me? No.
Are you sure? They also said you've been hiding vapes around the room to smoke when you're alone.
You know, it gets very cold in here at night. I think they're just seeing my breath in the air.
See? I must remind you that you are on oxygen and vaping is very bad for someone in your condition.
Okay, but I'm not vaping.
Then what is this?
That's not mine.
And this?
Also not mine.
You have one in your hand.
What? I don't know how that got there.
Okay, give me the vape.
Don't even think about it.
Ma'am, you're at a hospital. It's for your own good.
Don't make me do it.
Do what? Give me the vape.
I'm warning you.
Give it to me. Oh my... Why would you do that?
Take one step closer and I'm gonna throw it at you with my vagina juices all over it.
No, do not do that, okay? Calmly take it out of your vagina and hand it over.
Hey-ya! I warned you.
Oh my god, it's all over me.
Come any closer and I'll do it again.
I can't do this today. Security!
Yeah.
We're gonna get a urine sample using a catheter, and since this is a teaching hospital, we'll have our med student do it.
Okay.
Hey doctor, quick question. Which hole should I be aiming for?
Oh, that's funny.
I'm just joking. I know it's the front one. Unless it's the back. The side, maybe?
You don't know which hole the catheter goes in?
Remember, ma'am, this is a teaching hospital. The students are here to learn.
I would just hope after a year of med school, he would know.
Oh, this is my 3rd year, actually.
And they didn't get to the bottom half of the body yet?
There are no stupid questions in a teaching hospital.
I'm no doctor, but which hole feels like a stupid question.
Ma'am, please relax. The catheter will go in easier that way. That is correct. And the hole in which it is inserted is not the butt. Correct. Or the face. Also correct. But the general pubic area.
Excuse me, but I prefer a doctor who doesn't need to play 20 questions to find my urethra.
Urethra! Wow! I'm so glad you knew which hole. I was worried I'd have to look it up. Overall, baby looks healthy. Try to sleep when the baby sleeps, and we'll see you back here in a week. I have a question. Sure. Just to clarify, how much formula should I be giving my wife to make sure she's making enough breast milk for the baby? You're asking how much formula to give your wife? Yes. The formula is for the baby. Yeah, I know. It will be, eventually. As soon as my wife drinks it and turns it into breast milk. No. Your wife doesn't drink formula. Of course not, right now. But since we have a baby, I want to make sure she's making enough breast milk. No, sir, you're not getting it. Your wife doesn't need formula. Not now, not ever. Oh, okay, I get it. Okay, good. She doesn't need any formula because she's already making enough breast milk. No, that's not it at all. Okay, look, I think you're making this a lot more complicated than it needs to be. Just give me a number, okay? 10 ounces. Too much? Too little? Sir, it's not a matter of a number. 6 ounces? No, listen. Blink twice if it's 4 ounces. You don't understand. There is no... He blinked. He blinked, honey. It's 4 ounces. Mrs. Price, will you please talk some sense into your husband? You told her to sleep when the baby sleeps. Right. Got a call for a broken defibrillator? Yeah, it's busted. The pacing function isn't working. Oh, bummer. You know, it took you guys long enough to get up here. Oh, pacing looks like it's working just fine. How exactly were you testing it? My patient didn't jump when it indicated pacing. We hooked him up, tried to shock, and nothing. According to this, everything looks like it should be working. Maybe it was hooked up wrong? Are you saying I didn't hook it up correctly? No, I'm not saying that at all. Who do you think you are? Huh? I went to Harvard. Where did you go? Riverside Community College? Well, yeah, actually. And then I transferred to Azusa Pacific. Trust me, it's not working. I'm not an idiot, okay? Look, hold on now. Oh, dude. Code Blue, ER room 2. This is gonna be a long incident report. Okay, sir, you're here for abdominal pain. I was attacked and they shoved a bottle up my butt. What? Who attacked you? That darn masseuse. Oh. Whoa, that is pretty high up there. Why did they attack you? I was getting a massage and I didn't tip her, so she shoved a bottle up my butt. Whoa, you didn't tip her? How is that medically relevant to you right now? Well, you should always tip your service workers. Who gives a f***, man? Take it out! Hold on now, let's just think about this a minute. Are you debating leaving it in? No, that would violate my Hippocratic oath. Your what? I took an oath as a doctor to do no harm to my patients, although it never explicitly said anything about bad tippers. I'm sure it was implied! Alright. Although, maybe I'll just leave the tip in. I see what you did there. Okay, here we go. Oh, it's out. Thank you, doctor. And you know what? I've really learned my lesson. Here. 5%? That's it? No, don't do it. Remember your oath. Room 214, possible seizure, artifacts everywhere. I'm on it! Oh my god! False alarm, not a seizure. Oh, yeah, no, I'm fine. It's just a little stress relief. But when I am on the home stretch, my legs do tend to seize up. Sir, it is 3 a.m. and you are not in a private room. Thank you. What? It's natural. Besides, my doctor says I need to improve my circulation. I'm sure your doctor was thinking of yoga or going for a jog. Ew. I prefer wagging the dog or choking the hog, if you know what I mean. Yes, I've been knowing what you mean for the last 20 minutes. Sir, you are in a shared room, which means you must respect the other patient's privacy and boundaries. Oh my god, that's so rude of me. I should have offered. Oh! Now we can see who could blast off the rocket quicker. Absolutely not! Yes, sir, please try to refrain from— You got a head start! Oh my god, what is happening? Just gonna close the door on my way out. You guys are gross! 54-year-old male, chief complaint, urinary retention. We got an order for an x-ray, foreign body object, and pelvis. You think he stuck something up there? Doctor thinks it's a BB pellet. I'm gonna say spaghetti noodle. Ooh, okay, put me down for a pipe cleaner. You got it. Huh, I don't see anything. Maybe he already passed it. Oh wait, is that a pyramid? Is that the tip of a Bic pen? Sir, did you put a pen in your urethra? Yeah, isn't that clear from the x-ray? Why? I had to pee and nothing was coming out.
You punctured your bladder. You know, they actually designed the big pen so you could write underwater, even in outer space.
Now is not the time, Alan. Hey, that's a pretty interesting fact.
Not another word out of you. I'm calling the OR.
Hi, I'd like this prescription filled.
Yes, of course. Let's see here. Yep, we have it. Just so you know, it's not covered by your insurance.
What?
You'll have to pay for it out of pocket.
That can't be right.
Sorry, it is.
Could you check again?
Okay. Yep. Still not covered.
What? You're being outrageous.
Me?
Yes, you're denying my husband's medication.
You can have it if you pay for it.
This is what's killing my husband, you know.
Not having his...
Your poor customer service.
That's not medically possible.
You're a murderer. You're murdering my husband.
I'm definitely not.
You are withholding life-saving medication.
It's sildenafil.
So you admit it.
It's for erectile dysfunction.
Fine. If you won't give it to me, I'll go somewhere else that will.
Be my guest.
While I'm here, you may as well at least help me with something.
What is it?
Can you double what's prescribed?
Double?
Double.
Sir, you're not supposed to be eating anything. I haven't eaten anything. What is that white stuff around your mouth? Oh. That nurse earlier gave me some weird tasting Tylenol. Weird tasting Tylenol? What are you talking about? She said she was gonna come back to help me with it. Sir, that was rectal suppository Tylenol. Rectal? As in the other hole? Huh. So if that was rectal Tylenol, what did I just shove up my ass?
Sir, please, we need to get you undressed and into a gown so we can get you to surgery.
Okay, but like, do I really need the surgery?
You nearly cut your arm off with a chainsaw. Yes, you need surgery.
But do I really have to get into the gown?
Yes, you need to get into the gown.
What if you just cut my shirt off and leave my pants on? Patient ready for OR?
No, he refuses to get into a gown.
I'm sorry, but y'all gonna have to work around my clothes on this one.
Sir, you're gonna lose that arm if we don't start operating in the next few minutes. We need you in a gown.
Nope. Rather lose my arm than let you two see me undress.
How could that possibly be true?
It's kind of embarrassing.
You're gonna lose your arm.
I mean, it's really embarrassing.
Sir, I absolutely promise you, whatever it is, we've seen worse. So just tell us what it is so we can quickly move past this and get you to surgery.
Okay, I'm wearing my wife's pantyhose.
You wearing your wife's pantyhose?
Yes, I'm wearing my wife's pantyhose. My legs got cold and I put them on. I didn't think anyone was gonna see me, but then I nearly cut my arm off.
Huh. Can I see him?
Yeah.
Hey, they don't look too bad on you.
Yeah? They're actually real comfortable too.
Guys, the surgery. Oh, right.
Hi, ma'am. What seems to be the problem?
I think I gave my baby shaken baby syndrome.
What baby? Where's the baby?
The one inside of me. I'm 8 weeks pregnant.
Oh. How exactly are you hurting the baby again?
I have a vibrator stuck up my ass and it's shaking it.
Is that what that sound is?
Oh, my poor baby.
No, ma'am, you have nothing to worry about with your baby.
How could you say that?
Because you can't give a fetus shaken baby syndrome. It doesn't even have a fully developed brain yet.
Because I've scrambled it with my insatiable desire to pleasure myself.
No, ma'am, that's not what I mean.
And now it'll never have a brain because of that one incredible night I tested the limits to see how far up it could go.
Ma'am, listen to me. The vibrator won't hurt the baby no matter how far up it is.
Are you sure?
I am positive. Now, please try to calm down.
Oh, that's a relief. Thank you.
Betty, will you come help me with something in here?
Present! Is that the Magic Vibration Masher 4.0 in purple? Oh my god, it is! It's so good, isn't it?
Betty, we need to remove the vibrator from this woman's rectum.
Actually, doctor, if it's not hurting the baby, you could just go ahead and leave it in there. Oh.
I should have been a radiologist. Hi, Mr. Reynolds. I heard you wanted to meet alone, without your wife?
Yes, I did.
What seems to be the problem?
Listen, man, we're really here for her, okay? You have to help her. I think she's growing testicles.
What room did you say she was in?
Actually, I also have a hangnail on my big toe. Can you take a look at that first?
Right. Hi, ma'am. Are you...
Yeah, I think I'm growing testicles.
Okay. Why do you think that?
You want to see?
Well, let's just... Oh my god!
They are testicles, aren't they?
Ma'am?
Is it because I ate my husband's creatine gummies? Because I thought they were fruit snacks.
Ma'am, that is not testicles.
It's not? Then what is it?
That is your vagina.
That doesn't make any sense. Why is my vagina hanging on the outside?
It's called a vaginal prolapse. And from what I could tell, yours is stage 4.
So it's not a testicle?
Definitely not.
Oh, thank goodness. I thought I was gonna have to change my name to Pedro.
That is a stage 4 vaginal prolapse. I'm gonna refer you to GYN and myself to some therapy. Stat.
Oh.
Okay, sir, your allergy test came back. What'd it say? Is it bad? Just various seasonal allergies. Nothing too serious. Your body did react to things like grass, pollen, trees, weeds.
Weed? Did you say weed?
No, weeds.
Oh my gosh, this makes so much sense. Every time I smoke it, my body feels so weird afterwards.
No, sir, you're not understanding.
I get paranoid, forgetful, and I get really, really hungry.
Weeds.
It's also really hard to talk to girls at parties. Wow. This allergy's really ruining my life, huh?
Sir, you are allergic to weeds, not marijuana. All those things you're describing are just common side effects of smoking pot.
Whoa. You sure?
Yes, although after everything you've told me, I'd recommend avoiding that too. Allergies aside.
That's good to know. Thanks.
You're welcome, sir. Do you have any other questions for me?
What did it say about cocaine?
Mr. President, thank you so much for taking the time to meet me.
Oh, it is an honor to meet the president of the Nurses Union. So, how can I help?
The staffing shortage is dire, Mr. President. Most units are reporting unsafe staffing ratios, and burnout is rampant. We want to continue to help our patients, but under these conditions, we need help ourselves.
You are so brave.
Thank you.
You're so brave.
Thank you. What we're asking for is a 25% increase in wages over the next 4 years, as well as a promise for additional hires and an internal registry for on-call union nurses. Is everything all right, Mr. President?
You are so brave?
Again, thank you, but we really need these changes in order to retain staff.
Staff. Okay, I hear you. And I hear your concerns. I think we can work something out.
Well, that's great. Thank you, Mr. President.
My first counteroffer, which I think is very fair, pizza on Tuesdays.
No, sir.
But only one per unit.
Sir!
And none for the night staff because I never have to see them.
Sir! These are your employees, the backbone of your company. Have you no sympathy?
Look, I get it, and we're all operating at a loss. I never told this to anybody, but last year, my salary got decreased by 10%. Decreased? I mean, can you imagine only making $12.7 million a year when you made $13.7 the year before?
Mr. President?
Oh, thank you, Giles. I was just informing my publicist that wearing a t-shirt makes me more relatable. Now, where was I? Oh yes, pizza on Tuesdays!
Mr. President, me and 30,000 of your employees are willing to walk out and strike if you are unwilling to meet our demands.
Secretary, get me Brian on the line.
Yes, Mr. President. Brian on line 1, Mr. President.
Thank you. Oh. I would like to apologize for my behavior earlier. You guys aren't just the front line of this organization. You are this organization. We would be nothing without you. That was my friend Brian Nickel, the CEO of Starbucks. As a token of my appreciation, I would like to offer each and every one of you a free medium coffee.
Well, that's very kind of you, Mr. President.
After you spend $20 or more on eligible goods.
Mr. President, come on!
Oh my god. Hey, have you spoken to the new resident?
Nope.
Good luck. Every July with these stupid new residents. I hope this one can at least spell LASIK.
Hello, this is the new medicine resident. I appreciate you calling. How can I help you? Hey, this is 3 West. I'm calling about a patient in room 314. That is Mr. Johnson, correct? Yes. What's going on with Mr. Johnson? Well, he's more confused than normal, and he spiked a low-grade fever of 100.1. Ah, yes, I saw. You did? Yes, I was just looking at his chart.
You weren't?
Yes, I try to stay on top of my patients. I saw you entered the temperature 20 minutes ago. That's right. He has a history of BPH, neurogenic bladder, and diabetes, all putting him at risk for developing UTIs. Any other symptoms? Well, I figured you want to put in an order for a straight cath for a urine specimen collection. Order already entered. It is? Yes, and I had some time, so I came down to do the straight cath, too.
Really? Yes, I just finished.
That was the best catheterization I ever had. Didn't even feel it go in.
I'll bring it down to the lab now.
Are you sure?
Of course. You nurses are the backbone of our healthcare system. You relax. I've got this. Is there anything else I could do for you tonight?
No, I don't think so.
Okay, well, my line is always open.
Doctor, wait!
Yes?
Thank you.
Anytime.
Hey, was that the new resident? Uh-huh. I need to talk to them. Are they nice? They were perfect.
You promised me the baby. We have a receipt.
It's not a receipt. It's a Venmo request.
Oh, what the hell is going on here? She's backing out of our deal. What deal? That baby is ours. We're paying good money. You try to buy a baby? We're legit. We swear. Here's cash then, okay? 20 grand.
My baby is not some patio furniture from Costco.
Ma'am, this is not legal. At all. My husband is downstairs with the police right now. They're gonna make you give us that baby. They absolutely cannot do that. Wait, you called the police? I heard someone was selling a baby?
Yes, arrest everyone. Not the baby. 25-year-old female reported altercation with two visitors claiming to have purchased her baby for $20,000. Physical and verbal assault ensued. PD arrived, arrested all parties, excluding the baby. Baby is currently resting quietly in the nursery, blissfully unaware of the felony charges surrounding its existence. We'll continue to monitor. Save. Ben, meet your new coworker and our old friend, Austin.
Thanks, Rich. Good to see you, Ben.
Hey.
He's a cranky old guy.
We're the same age, Rich.
Yes, but I moisturize.
Anyways, I'm going home. Ben, if you need anything, Austin is your guy. Toodaloo. Good luck. I need you to help me bring these pudding cups to Miss Morales in room 27. She's here because she can't stop shitting out of her colostomy.
Why the pudding cups?
Because she won't stop hitting her call light unless she gets her pudding cups. Come on, I'll introduce you. Miss Morales, are you done with these pudding cups?
Yes. Oh, and you brought me new ones. Hi, Miss Morales. My name's Austin. I'm gonna be taking care of you today.
Miss Morales, are you gonna finish this one?
Oh, no.
Why not?
I emptied my colostomy bag in that cup.
You what?
Oh my god.
Why didn't you say something before I picked it up?
I'm so sorry, dear. I had to empty it somewhere.
That's what this is for!
Why are you still holding it? Oh. It's all my fault. Ever since I let that man put it in my colostomy, I've been having so many problems.
You let that man put what in your colostomy?
It's how I get paid on the streets, dear.
You're letting men pay you to have sex with your colostomy?
Oh, that's called a Philadelphia sidecar.
Why do you know that?
Well, that's why I'm here, dear. I think I have an STD in my colostomy.
Why do you think you have an STD in your colostomy?
Because I've had one before, and this feels just like last time.
Miss Morales, you cannot continue to let men have sex with your colostomy. An STD in your stoma is very dangerous and gross.
Whoa, hey, let's not judge too harshly now.
Whose side are you on?
I'm just saying, streets are rough. Girls gotta eat.
I can't deal with this. I'm gonna call the doctor.
Don't worry about him. He's a cranky old guy. Oh, it's okay, dear. I know sex work can be very misunderstood. He is right, you know. If you keep using your stoma for sex, you're gonna get very sick. It's dangerous. I know. I'll try to stop. But it's just the money is so good. I'm sure it is. $20 each time. $20? That's it? Well, you think I should charge more? I know you could charge more. I will for next time. Thank you, Austin.
No! Happy to report your daughter is very healthy. No immediate signs of any problems.
Are you sure? Did you even check for diabetes?
Well, no. For that we would have to do a series of different testing, but as of right now, I don't see any reason to.
Let's do it, whatever it costs. We do not want to risk it.
Can I ask why you think your daughter has diabetes? Because looking at her numbers, she's perfectly healthy.
She's been exposed!
Is there a family history of diabetes?
No, our family is perfectly healthy.
Has she had high blood sugar in the past?
No.
Does she have any symptoms of diabetes that I'm not aware of?
Not yet, which is why we want to test it before it's too late.
Okay, what did you mean by she was exposed?
Last week, I let her go on a play date at her friend's house, and today I learned that that friend has type 2 diabetes. We're afraid she may have caught it.
Oh, no, ma'am. Type 2 diabetes is not contagious.
What about type 1? That's the one you can catch, right?
Nope, can't catch that one either.
Or should I try to have her catch it before it becomes too dangerous, like chickenpox?
No, ma'am, you don't seem to be understanding.
I think that's a good idea. Honey, make sure to invite all the bigger kids to your birthday party. Anyone who walks the mile in PE.
No, ma'am, you can't catch diabetes. You can't give diabetes. Your daughter is perfectly healthy. You have nothing to worry about.
Okay, but what about asthma? Can you test her for asthma? Because there was a girl on her soccer team with an inhaler.
None of those are contagious.
Oh, are you sure?
Well, I might have been touching myself last night by maybe putting a Tic Tac in and out of my pee hole, and it may have gone too far, and now it might be stuck.
I see. But you've been able to pee since then?
Well, yeah, but it burns, and orange pieces of Tic Tac are coming out. This is like really bad, isn't it?
Well, it's not really good, but luckily I have a colleague who used to work in urology. Let me call them and see what they can do. Hey girl, hey!
Betty, I was just calling you.
Why? Because I'm in my main character era?
No, because...
Because you need to make a charge and my face card never declines?
No, because...
Because this man put a Tic Tac in his urethra, got it stuck, and you're hoping I know what to do because I used to work in urology?
Yes.
How did you know that? I heard everything from outside the door. Hello. Okay, King. First things first, we have to determine if that Tic Tac, which I am legally rebranding to Tic Tac, is going to dissolve.
Betty!
What?
That's so rude! That's okay. How do we know if it's gonna dissolve?
Betty! What? I have to experiment to see if it's going to dissolve. It's like, how many licks does it take to get to the center of a Tootsie Pop? The answer is 1,000.
Okay, fine. What happens if it doesn't dissolve?
Then we need to determine if it's caustic to the urethra. That means we need to determine if it's dangerous to the inner lining of your pee hole, good sir.
How do we do that?
Just dropped it in my urology group chat, and good news, tacs are not toxic.
Oh, that's great. Is there bad news?
Well, the bad news is because they're not Skittles, you won't taste the rainbow. Woo! I am on fire today.
Betty, focus, please.
Okay, real talk, we have to see if the doctor can remove it. If not, he's gonna prescribe you Peridium.
What's Peridium?
Pain reliever. Totes perf for your situation. But a side effect of Peridium is that you will pee orange.
But I'm already peeing orange.
Correct! But this time it won't be because of the tax. You're in your orange pee aesthetic era, babe, and I am so proud of you.
Thank you so much, miss.
Yes.
Thank you, Betty.
You're welcome! Okay, besties, this main character is clocking out of the storyline, but don't you worry, I'll be back for my sequel. Ta-ta now. Who was that?
Where is the OB?
She just DM'd me. She's stuck in traffic. Okay, Miss Garcia, you need to push. Push!
Betty, you can't just say that to Miss Garcia. She doesn't speak English.
Oh my god. Miss Garcia, I am so sorry. I am so lo siento.
Wow, you're like fluent.
I am. She had a 4-day Duolingo streak last month. Yes, she did.
We need someone who speaks Spanish.
Okay, wait. When I was in Cancun, I was trying to open this door, and this really nice man said puta to me, because it was a push door.
Puta. Okay, that sounds like push.
It does.
Miss Garcia.
Puta. Puta, Miss Garcia. Puta. 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 Puta.
Breaking news. Maria Garcia, a new mother, is suing the hospital where she gave birth for racial discrimination after repeatedly being called in Spanish. The 2 nurses have been placed on temporary leave as the hospital investigates the situation. What seems to be the problem, sir?
It's my lips. They keep having this horrible, painful reaction.
Oh, what kind of reaction?
They get really dry and bumpy, just out of nowhere. It hurts so bad sometimes, I can't even open my mouth.
Any allergies?
No, that's why it's so weird.
Huh. Are you doing anything before it happens?
Yes, I've been keeping track. It happens whenever I eat fast food.
Okay.
Or potato chips, or drink soda.
So, anything with sodium?
Yeah, I guess. It also happens a lot more when it's hot out. Or when it's cold out. What's up with that?
That is weird. Does it happen any other times?
Whenever I don't drink water.
And how long without water before you notice a reaction? like a day and a half maybe.
You go a day and a half sometimes without drinking water?
Yeah, but get this. Anytime I finally do get some water, poof, the lip thing goes away. Like magic. Yeah, magic. What do you think it is? It's not cancer, is it?
Well, if my many years as a medical professional has taught me anything, I'd say you have what we refer to as chapped lips. What? That's it? Yes, and you have nothing to worry about because I see it all the time. I'm gonna write you a prescription for 3 sticks of lip balm and a large bottle of water. These can be picked up literally anywhere that sells anything. Have a nice day.
Hey, nurse, you have to help me.
Oh, what's going on?
I'm having a heart attack.
What are you, like 20? Do you have any medical history of anything? Drug use?
No medical problems, no drug use. I'm in school.
Well, good news is the chances of you having a heart attack is super low, but just to be safe, we'll order an EKG.
Look, I'm a pre-med student, okay? And last I checked, doctor outranks nurse. So I'm gonna need you to stop gaslighting me and give me the care I need. And what I need is a full workup. Right now.
Well, full workup it is for the future doctor.
2 hours later.
Hey, we're gonna discharge that 20-year-old chest pain. Why did you order a full workup? As a pre-med student, he informed me that I was lower than him in the hierarchy, so I gave our future doctor just what he wanted.
Oh, wow, he messed up. You know, he ended up having like no veins. We had to call a nurse down from NICU to get his blood.
Oh, was he a hard stick? I hadn't noticed. Let's go discharge him.
So, all your tests came back negative. The chest pain is most likely from stress and dehydration. I imagine it's the week before finals.
It is.
You know, it's very rare for someone of your age and health to have a heart attack. And I wouldn't have ordered all that blood work.
Oh, wow. Imagine that. I guess we both learned something valuable today, didn't we?
Look, it's always good to get your chest pain checked out, and it's always a good idea to advocate for yourself, but learn to work with the nurses, not against them. They know what they're doing, okay?
Okay.
Well, good luck with finals, future doctor.
No! Med-Surg, this is...
Hello, Med-Surg.
Hello, ER.
I'm calling to give you a report.
You know, we usually don't take report after 6:35. Do you mind waiting to the next shift?
Oh, well, I didn't realize that after 6:35, you no longer had to do your job.
That's not what I said. And also, it's only 6:34. Bed management literally just booked the room.
And I am calling to give you a report. I have a patient going to room 303, bed 1.
Oh, well, the patient in room 303, bed 2 is actually a screamer. Bed management should have blocked that room.
My patient is deaf.
Yeah, my patient is confused and strips at all times of the day.
My patient is also blind.
Can I get their medical record number?
Why?
I'd like to make sure the patient's orders are put in correctly.
The resident is putting in orders now.
Oh, so you're telling me you're sending me a patient with incomplete orders.
Medical record number 4000051698. I see the patient's last vitals were taken at 5:15.
That's correct, and they're stable. And they may not be anymore. I'm gonna need a repeat set of vitals before they come up.
Done.
It also says the patient has a history of bradycardia.
That's their baseline.
But in triage, it says dizziness.
That's been resolved.
Have they seen a cardiologist?
Yes, they have been cleared for your unit.
Do they have a diet order?
Like I said, the resident is putting in the orders now.
Dinner trays are being brought up right now. If this patient doesn't eat, they're gonna be starving all night.
I will make sure they come up with a dinner tray.
They're diabetic.
I'll recheck their blood sugar.
Fine. Give me a report.
Like I said.
Help! Room 303, bed 2's Foley's leaking all over the floor! I'm so sorry, ER. Bed 2 just had an accident, and we're gonna have to call EVS to clean it up. So, why don't you go find a bed elsewhere in the meantime?
I'll get you next time, Med-Surg.
Can you please come help me?
Oh, yes, coming.
Sharon, you really shouldn't be working so hard after giving birth. I have people who rely on me.
Well, I'm gonna take your little one to the nursery. We'll be back in a few hours so you can breastfeed.
They said the baby is perfectly healthy, right?
Baby's perfectly healthy.
See? Told you.
Okay, Sharon, ready to feed your...
Hey, have you seen my patient who just gave birth?
No, is everything okay?
I can't find her anywhere. It's time to feed her baby.
How long has she been missing?
3 hours?
3 hours? Why didn't you say something earlier?
I thought she was just walking around working. I was waiting for her to come back.
For 3 hours?
I know. Help me.
Have you told security yet?
They can't find her either. Do you think something happened to her?
I don't know. Does she have an IV?
Oh my god. She does.
Any history of drug use?
I don't know. Am I gonna lose my license?
Okay, just calm down. Try her emergency contact number. Maybe she's with them.
Okay. Hello?
Hi, I'm looking for Sharon.
Speaking. Oh my god, Sharon, where have you been? We've been looking all over the hospital for you.
Oh, I had my friend come pick me up. I had to go home to see my baby.
You have other kids?
Oh no, Mr. Snuggleton, my cat. It's almost time for him to eat. Yes, it is.
Okay, but what about your actual baby? It's her feeding time too.
Oh, right. Can you just give her a little Jell-O? No red, though. I heard the red dyes are bad for kids.
I would give her formula.
Perfect. I'll be back soon.
No, Sharon, you need to get back here right now. You still have an IV in your arm.
Oh, this thing? I'll just pull it out.
No, Sharon, do not pull out your IV.
Done. Oh my, that's a lot of blood.
Are you freaking kidding me?
Welcome to the ER, sir. How can I help you?
I have something stuck up my butt.
Okay. Can you give me a little bit more information?
I slipped in the shower.
You slipped in the shower.
Yeah, and somehow this object, which I think my roommate left in there because I had never seen it before, was sticking up perfectly straight, and I fell right onto it. And now it's stuck.
Okay. How long has it been stuck?
Well, let's see. It happened last night, and then I tried to sleep it off, but that didn't work, so I went to work today.
You went to work all day with a foreign body object inside of you?
Yeah, the auto body shop would have been short-staffed if I didn't go in.
I see. What exactly is this object?
It's purple
Uh-huh.
and phallic in shape,
Okay.
and it vibrates.
You have a vibrator stuck inside your butt, don't you?
Yeah.
And you went to work all day with it vibrating inside of you. Impressive. I'll call surgery. Okay, the object was safely removed. You are good to check out.
Oh, great. Thank you so much.
No problem. Have a nice day.
Oh, wait. Can I maybe get that object back? It's not mine, like I said, but whoever it belongs to might be pretty disappointed to lose it.
Fine. But for future reference, tell whoever it belongs to that this type of machinery is for external use only. We wouldn't want any more mysterious shower accidents.
No.
Again!
Oh, hi, doctor. I didn't know you did rounds this late.
Look, kids, the nurse is wearing a scary costume for Halloween.
Oh, not a costume, just my regular scrubs.
We're playing a game.
Oh, right. I'm in costume. Happy Halloween.
What do you think she's dressed as?
A pumpkin, a werewolf, a really tired person with bags under her eyes.
I'm not loving this game. I just started. I don't think we've met. Dr.
Dr. Fitzgibbons.
It's nice to meet you. I'm honored to be working at a hospital with such long history.
You know, some people think this hospital is haunted.
I don't believe you.
It's true! There's a ghost who roams these halls and puts spooky things under your covers.
Like what? Is it slime or blood? Is that nurse the ghost? Her skin is so pale.
I think he's talking about your makeup.
The lady at the store said this foundation was a good match.
Look what the ghost left you!
Oh, doctor, do you really think it's a good idea that they get candy?
Oh, but the kids didn't get to go trick-or-treating tonight.
Please. Let us have the candy.
We
We promise not to mention your split ends.
You kinda just did. Fine. I'll just get their vitals and I'll leave you to it.
Yay! Yay!
I just met Dr. Fitzgibbons.
He's a hoot.
Dr. Fitzgibbons?
Yeah, you know, tall guy, gray hair.
I know who he is. He died 4 years ago.
Are you sure?
Yeah, I went to his funeral. He was the head of pediatrics. Great doctor. You could tell he really cared about the kids.
The kids saw him too.
They were probably just playing a prank on you. Unless Dr. Fitzgibbons was a ghost. You know, it's nice to see you getting into the Halloween spirit.
Why? Because you think I saw a ghost?
No, because you're wearing a costume.
This is not a costume. Oh my god! Hello, sir. How can I... Oh my god! Sir?
It's poop.
What?
Don't worry, I'm a farmer. I just didn't want to be late.
Oh, so that's cow poop.
The cow poop? Ew, that's disgusting. No.
Then what is it?
It's me. I poop my pants.
Okay. Red flag. Is that normal for you?
No. I just didn't want to be late to my chemo appointment. My farm's already 3 hours away. If I stopped to use the bathroom, I would have been late.
So you pooped in your car while driving?
Yeah, I didn't want to be late. That's rude.
How is this better?
You'd rather I'd be late to my appointment?
Sir, being 10 minutes late is always better than showing up in your own poop.
Jeez, okay. I'll know for next time.
Hi, I need assistance in room 4. He has a chemo appointment, but he's gonna be late.
You're making a big deal out of nothing. It's just poop.
Fecal matter is in fact a biohazard, sir.
Ugh. What type of ring did you say this was?
A key ring to help with stimulation.
Okay, well, for future reference, I would stick to using rings that were designed specifically to go in your manhood.
That's what I told him, but he's too embarrassed to go to a proper toy shop.
For the love of God, honey, not now.
How long has it been stuck like this? Well, it would have been the last time we did it, so about 3 days ago?
Yep, 3 days ago. Definitely 3 days ago.
Are you sure? Looks more like a recent injury, like 1 day max.
Nope, it was definitely 3 days ago.
That wouldn't make sense. If it was 3 days, you'd be in much worse condition.
Are you saying my husband was with another woman yesterday?
Dude, what are you doing? Just tell her it's been 3 days.
Yeah, it could have been 3 days. I could check again. Nope, definitely no more than a day.
Dude, you son of a bitch! Who was
You
she?
should probably apply some lubricant.
Tell me right now!
Maybe get you some pain medication.
Fine, you really want to know? It was Shirley, okay? You happy now?
Shirley is my best friend, you a-hole!
Definitely gonna have to call surgery.
I knew you were looking at her ass during my birthday. I'm filing for a divorce right now.
Thanks a lot, man. You cost me my marriage.
My apologies. I'll be more courteous next time I have to give a accurate diagnosis. All right, sir, we got your labs back. Good news, your HIV viral load is undetectable, but you did test positive for syphilis.
Oh, great. Just great.
Well, nothing that a shot of antibiotics to the buttocks can't handle.
No, it's not that. It's just... I have a date tonight.
Oh, you can still go on the date, just make sure you stick to first base.
But you don't understand. I already cleaned out.
I'm sorry?
I already cleaned out the trunk of my car.
I am not understanding.
I already douched.
Oh. Well, no reason to waste a perfectly good enema. Just tell your partner, use protection, and make sure he's on Doxy and Prep. Really? Yes, but make sure you use protection.
Oh, I'm definitely not using protection.
No, sir, if you don't use protection, you risk giving your partner syphilis.
Oh, he's gonna be okay with it. He gave me something way worse a few years ago.
And you know what? As a medical professional, I advise you not to say what you're about to say.
It's payback time.
No, sir, please, use protection.
Revenge is best served raw.
What have I done? Sir, you need to poop. It's been almost 3 days.
You think I don't know that? I've tried everything. Laxatives, prunes, reading, walking, calling my mom.
Your mom?
I was desperate. It didn't work.
Well, we've got to figure out something.
Maybe it'll help if you stay in the room while I try to go.
Or maybe just call your mom again. Okay, I'm just gonna give you some privacy.
Wait, stay. I think you being here is helping.
Really? Because it's hurting me.
Seriously, it's working. The closer you get, the closer I get. It's almost there. I can feel it. Oh no.
What?
I think it's stuck. Quick, hold my hand. It'll help me go.
What? Ew, no. What do I look like, a human laxative?
Come on, man, hold it. Stop being such a bad nurse.
No, hold your own hand.
Ugh, fine. I don't need you. I'll do it myself.
No, what are you doing?
What does that look like? I'm getting myself unstuck. Just gotta get it at the right angle. Ah! Oh! Oh! Wow.
Wow, I feel so much better. That makes one of us.
Excuse me?
Yes? Aren't you gonna help me wash my hands? No, something tells me you could do that yourself too. Man, the service here is shit. Okay, sir, I see you're here worried about an STI.
Yes, I caught my girlfriend cheating on me.
Are you having any symptoms?
How could she do this to me?
Sir, are you having any symptoms?
No, but I should get checked just in case, right?
Yes, of course. The doctor ordered a urethral swab.
What's that?
We insert a swab into your urethra to collect a sample.
Oh. Yeah, no, right, of course.
Do you understand what a urethra is?
Hey man,
You sound just like my girlfriend, always calling me an idiot. Of course I know what urethra is.
No, not Aretha like Aretha Franklin. Urethra.
Are you calling me stupid?
No, not at all. I think you got it. Go ahead and pull your pants down and your underwear and we'll get started, okay?
Oh, hell no! You're not sticking that in there, man! You're crazy!
Sir, you left your pants! You could have at least given me some respect.
R-E-S-P-C-T, find out what it means to me.
Got here as fast as I could. Where's the emergency?
The baby's crying. Again.
Okay. And what would you like me to do about that? Make it stop? The sound's getting pretty annoying. Okay, so that's a baby? Crying is kind of his whole thing.
Well, his thing is giving me a migraine.
Yeah, can't you work your magic or, whatever?
That's what you do, right?
Not exactly.
Thanks, you're a lifesaver.
Also, diaper's full. Of course it is. Anything else I can do for you guys while I'm here? Maybe file your taxes?
Oh no, we did that already. We're responsible.
Right. Just not with your baby. Oh no, we're great with kids. Just, not this part. You mean the parenting part?
Exactly. Ugh. It's the crying, the feeding, the holding.
The sleeping, the waking up, the diapers.
The whining, the burping, the spitting.
So, the baby. Pretty much.
But he'll grow out of it. At least that's what happened to our other ones.
I'm sorry, your other ones? What, you thought this was our first kid? No, this one's our third.
We're pretty much pros at this point.
Uh-huh. Where exactly are your other two kids right now? Oh, they're right over... Well, they're just here somewhere. Fantastic. 2 missing kids, 1 dirty diaper.
Hey, while you're holding him, can you make sure he's eaten? I think he might be hungry.
Huh, yeah, sure. Why don't I just breastfeed him for you while I'm here?
That'd be great. You're the best.
Blink twice if you want me to call Child Protective Services. Okay, sir, you're having numbness from the waist down?
Yeah, sometimes I could feel my legs, and sometimes I can't. It's kind of hard to explain.
How long has this been going on for?
Oh, well, maybe... He's been ignoring it for 2 months now.
And you are?
Oh, I'm his wife, darling. Who else would be in here in the middle of the night with him?
I see. Sir, you're also having random falls because of the numbness?
Yes, like Toy Story.
I'm not following.
You know, Andy's coming! And everyone just drops like a lifeless toy. That's how he falls. I call it Andy's coming home syndrome, the way he just falls like those toys.
Sir, is that an accurate description?
Well, to be honest with you, I ain't never seen Toy Story, so...
You've never seen Toy Story? I'm sorry. Please continue.
Yeah, that's an accurate description.
Okay, and how are your erections?
Oh, those haven't existed in years. I call that Andy's home, and he never left. He's a shut-in. Yeah, that's correct.
Well, I'm gonna go let the doctor know what's going on. In the meantime, we do have a monitor here. You can watch a movie. We do have Disney Plus if you're interested in, researching your case further.